Hello everyone, my name is Amir. I'm the Hematology Registrar. Welcome back in the Hematology Bleeps. Let's talk about high platelet count in our today's talk. We receive calls from different medical and non-medical teams that the patient platelet count is high. Is this a hematological malignancy or not? So, high platelet count does not mean that the patient will have hematological malignancy. There are many different causes for high platelet count. First of all, check your patient hemoglobin, please, whether it is low or not. If the hemoglobin is low, cast an eye on MCV of the patient. If the MCV is low, likely this patient has iron deficiency anemia, so check the patient iron profile. So one of the major cause of high platelet count in UK is the iron deficiency anemia. How iron deficiency leads to high platelet count? This is a bit complex thing for you guys as a non-hematologist, but the major causes one of the major cause of high platelet count in the UK is iron deficiency anemia. So whenever you see high platelet count in a patient, above normal range platelet count in a patient, always check what is the hemoglobin and what is the MCV of the patient. If MCV is low, hemoglobin is low, then you should do the iron profile in the patient to see if this patient is iron deficient or not. When you replace the iron in the patient, you will see that the platelet count will come back to normal. Then the second important cause of the high platelet count is that if the patient has any infection or any inflammation flare up or not. Usually, patients are admitted to the hospital with community acquired pneumonia or biliary sepsis or peritonitis, etc. And when we do full blood count for the patient, the platelet count is on higher side. This high platelet count is because of the underlying infection. And if the patient has any inflammatory flare up, for example, of Crohn's disease or rheumatoid arthritis or SLE, the inflammatory flare up can lead to high platelet count as well. They can stimulate the bone marrow to produce more megakaryocytes and in turn more platelets in the bloodstream as well. So, one of the commonest causes of high platelet count in the UK is either infection or inflammation as well. So, whenever you see high platelet count in your patient, always cast an eye on the infection marker in the patient. What is the CRP? What is the white cell count of the patient? And cast an eye on the hemoglobin and MCV of the patient to see if this patient is iron deficient or not. These two categories are the common categories that lead to high deficiency. The high platelet count in the patient, iron deficiency anemia, and infection or inflammation. These are the two commonest causes of high platelet count in the patient. There are other causes as well, like post surgery, after a bleeding episode, after a hemorrhage episode. Some patient on long term steroids, they have high platelet count as well. For that purpose, if you are not sure, then yes, you have to contact the hematology registrar or consultant. But when you bleep the hematology consultant or registrar, you should be sure that you are aware about your patient condition. I mean, what is the hemoglobin, what is the MCV of the patient, whether the iron profile has been checked or not, is the patient septic, admitted with infection or not, what is the CRP in the patient, is there any inflammatory flare up in the patient or not. Because um, if the patient platelet count in the in the record is normal previously, and today when you check the full blood count and platelet count is high, so this is related to a reactive cause. Maybe there is something going on in this patient that has driven the platelet count above normal. Yes, if the platelet count is persistently high, like you check the patient electronic record, and since a few months or a year or more than a year, the platelet count is always above the normal range, then yes, then it can be a malignant cause or hematological cause of the high platelet count. Then you should inform the hematology team, and they would send some blood test for the patient to hematological diagnostic service to see if there is any mutation present in this patient or not. If your patient has thrombosis or a bleeding episode, and you notice that the platelet count is on higher side, then you must inform the hematology, because this patient may have underlying hematological malignancy, and because of that, the platelet count is high and it is causing thrombosis or it is causing bleeding episode. If the platelet count is less than 1500, it has the potential to cause clot. If the platelet count is above 1500, it has the potential to cause bleeding in the patient. So such patients should be referred to hematology on spot as urgent or as emergency. I mean, you should bleep the hematology reg or consultant that this patient platelet count is high and the patient has now clot or the patient has a bleeding episode. Hematology will take over this patient, because this patient would need further investigation, and most likely this patient would have underlying hematological malignancy, and which would need treatment and intervention. So when you pick up your phone and when you bleep the hematology reg or consultant regarding high platelet count, make sure that you are aware of the patient hemoglobin. You know about patient MCV. If they are on lower side, you would have checked the RN profile. If they are okay, cast an eye on the inflammatory markers of the patient, infection markers of the patient, whether they are normal or they are abnormal. If there is any infection or inflammation in this patient, then it is most likely related to infection or inflammation. And one of blood tests that shows high platelet count does not mean hematological malignancy, but yes, if the platelet count is persistently high for months and months and more than a year, then yes, there is something in this patient which need to be investigated by the hematology team. Again, as usual advice, if you are unsure, bleep hematology. Thank you very much.